Now I'm joined by Dr. Rodriguez, and Brina has agreed to be our model today. So Dr. Rodriguez, what are we going to do today?
So usually when a patient comes in, especially if they have a particular lesion of concern, we get them up on the chair for a full exam if that's what they're going to be having that day. And what we usually do is we have a specialized scope where we can focus on particular lesions, and that'll help us magnify the spot and give us an understanding of whether there's any concerning features or things that maybe would prompt a biopsy in this particular patient. So usually, let's say Brina has a spot on her arm that she's been wondering about and is concerned, it's growing, it's maybe painful. So we take our specialized scope, it has polarized light, and we're able to focus in on that spot in particular and note if there's any features that might be of concern to us. Maybe it's bleeding, maybe it looks like it is a cancer that we should biopsy and sample so that we can take it to the lab and look at it under the microscope for some of these features that we were describing.
And then once you've studied it under the microscope, then what's the next step if there's a problem and if there's not a problem?
Yeah, so usually we get these specimens into the lab within 24 hours. They'll be on my desk and in preparation for slides. And so depending, like you're mentioning, whether it's a malignant lesion, let's say it's a basal cell cancer or a melanoma, for example, we notify the patient as soon as we have the results. And depending on the stage of the cancer, for example, or whether they're going to be needing to be referred to an oncologist or someone who might be of further support to the patient, we contact the patient and we plug them into the appropriate provider. There are some cancers that we take care of in-house ourselves, squamous cell cancers, things that maybe don't require oncology, for example. And so we schedule them for our surgical clinic, which you also have available here, whether with myself for generalized surgical excisions or if it's a specialized site, Dr. Yaos, as you might have mentioned, is our Mohs surgery on site. So, yes.
So that's amazing. So ultimately, once you figure out what it is, you either have the resources right here available or you're able to connect them to a network that will take care of literally anything that possibly comes up.
Absolutely. And I would say 95% of the cancers that we biopsy on site are probably things that we take care of in-house, whether it's myself or Dr. Yaos.
And your specialization, say it for me.
So I'm a dermatopathologist.
And that is different than a regular pathologist. Can you talk a little bit about that difference and why your specialization is really important for VitalSkin?
So there's different ways of getting to this position of dermatopathology, and my particular route was I was trained as a full dermatologist, and I'm a board certified dermatologist. And in addition to that, I took additional training in the pathology of the skin, and what that means is that I'm able to correlate what I'm seeing clinically because of my experience as a dermatologist with what I'm seeing under the microscope. And that's very important when we're communicating not only with our patients but also to our referring providers. We were able to provide them a level of correlation and they have some confidence that they're sending these specimens to someone who has experience not only looking under the microscope but also interacting with our patients.
And how often are you able to look at something, say on Brina's arm, and say, I'm pretty sure this is nothing, we don't need to biopsy it, versus looking at it and feeling like it's an issue? I guess, is it a thing where when people come in thinking it's an issue, it usually is, or is it a lot of times it's just nothing?
Yeah, I think it's important to emphasize to patients that no matter how concerned they are about a spot, they should come in and see us, because oftentimes there are things that are on their minds that maybe are very concerning because they've come up very quickly or look dark or potentially they're very preoccupied. And oftentimes we can come in and reassure them that this spot is something they don't have to worry about, but it's very difficult sometimes with a naked eye, for example, to make that determination. And so if a patient has any doubt whatsoever about a spot or a rash, I think it's very important that they come in and see a dermatologist, because we may be able to assuage their fears and put their mind at ease. And sometimes it is something that we need a biopsy, and if it is, as we've mentioned, it's something that we can take care of here.
Wonderful. Well, thank you so much for all of this information and for sponsoring our segment today.
I appreciate it.
And thank you for modeling for us. If you want more information, you can visit us on the web after the show at ciLiving.tv, and we would be happy to connect you with VitalSkin Dermatology.